Audio Jungle.
Hello, welcome back to the channel. My name is Dr. Kabli. You can find me on Facebook and Instagram, and this channel is dedicated to familiarize and make it easy to the public about the interventional radiology and interventional radiology techniques. So these are non-surgical techniques that we use to give options to patients who would like an alternative to traditional treatment like surgery or medication. So in this particular case, we're going to be talking again about prostate artery embolization, which is a new revolutionary technique that we use to treat people who have enlarged prostate. So in this case, I'm going to be talking about this special catheter that I have used a few years ago, and I was the first one to try it. It's basically called the Ninja microcatheter. The Ninja microcatheter is a steerable catheter that we allow the physician to orient and create a shape to match the internal structure of the arteries. So this allows us to navigate easily inside the complicated anatomy of the human body, as you see here when you introduce it inside the vessels. And let's say I'm trying to go into a small, tiny artery that has an angle, for example, the prostatic artery. So this catheter allows the physician to form the shape inside to match the internal angles and anatomy of the patient, and even in difficult cases, it allows us to navigate easily inside the human body to access the prostatic artery. So here's the real case scenario where I've tried this case. So here, this is what we call a common trunk, where the artery rises very high. So here I'm shaping the microcatheter to match that angle to allow me to either direct a small guide wire inside the vessel, or sometimes it's just enough to use this catheter itself to push it inside the prostatic artery, because this catheter has a good pushability from my experience with it. So here I'm advancing the wire selectively in the prostatic, and the tip of the catheter is very slim. It is very soft. It's respectful of the artery. It'll allow us to get really deep without any risk or damage for the prostatic arteries. Once we are inside, we need to go as close as possible to the target organ, and in this case it's the prostate. That way there's no risk for the surrounding organ. So here, this is the prostatic artery on the left side. We're going to advance it. It's very pushable. All we need to do is push it. This is images that I call a cone beam CT. It allows us to view a three-dimensional view of the prostate. It's like a simulation that the interventional radiologist physician will do just before the embolization. It allows us to prove and to see exactly, in this case, you can see the left side of the prostate, and I'm going to show it here. That is enhancing. There's a dye, a contrast that shows it. Again, this is a three-dimensional view. So this advanced imaging modalities makes the prostate embolization very safe in good hands. I can't stress enough the importance of using state-of-the-art equipment to remove all the risks. Once we confirm the location, we start injecting those microscopic particles, and you see here, this is a very pushable catheter that's easy to advance. From this position, I'm going to start my embolization procedure. So the embolization allows the patient, basically, if you look at the prior video for more detail, the embolization will simply reduce the blood flow to the prostate thanks to the particles that we inject inside the prostatic artery. Prostatic arteries will reopen over time, but in the meantime, the prostate will shrink naturally without any side effects of the surgery, such as sexual side effects, etc. This procedure will have to be repeated in both sides. So then we go check the other side. So this catheter is useful because of the large variety of and variation among patient, and even within a patient himself. The left may look different from the right side, etc. So this makes this procedure sometimes technically challenging for the beginners, and this tool may be handy and helpful. Again, once we catheterize the artery on the right side, we repeat the same intervention. Here I'm just showing how the catheter is really pushable, so called the perfected technique. Once we obtain stasis of flow, we can easily advance in here. As you see, I'm just advancing it. There's no need, not even a need for a micro guide wire. So this technique allows us to basically push a little bit more beads and obtain a more embolization for a better clinical results. Once the embolization is done, the catheter is retracted, is removed, and the physician will have to go check the other side. Again, these procedures are done in an outpatient setting. The patient is totally conscious, and there's no need for general anesthesia or invasive surgeries. As you see, patient have been treated and he will go home the same day. Again, catheter has been very useful. So this patient has a variant anatomy called the common trunk with the bladder artery, so it's a high variation, making the catheterization a little bit difficult. So we shaped the microcatheter to match the anatomy. From there, it was very easy to sneak in like a micro wire. Look, it's extremely fast, make it easy. We are basically entering the patient's blood vessel as if we were his own blood, all the way down to his prostate. This is what we call a super selective catheterization, a revolutionary procedures and advanced in medicine that allow us to treat the patient remotely without opening his body. And again, here is the prostatic artery on the right side with the typical 2 branches. So here we target selectively the branch that goes to the medial lobe. That's the medial lobe that causes problems, and very pushable. Again, microcatheter, no need for guide wire. We are literally inside the prostate here on the right side. I'm just pulling it back. And again, we perform our advanced imaging, 3-dimensional imaging, cone beam CT simulation that shows us enhancement exclusively of the right side of the prostate. You see the area that's white under the bladder. The bladder is the big white thing, and just below it where the arrow is, this is where you see the prostate gland. We don't see enhancement of the rectum, we don't see enhancement of the rest of the organs. So the simulation shows us that it's going to be very safe. We see a selective enhancement of the medial lobe. So this is where the beads kind of focus. Again, 3D imaging. Good equipment is key for this type of procedure. They are very, very safe, in good hands, experienced physician using very good equipment. There's virtually zero risk, and complications are very acceptable, very low complications. So again, the procedure is repeated. The microparticles are injected carefully inside the right side of the prostate. So again, I'm just stressing the fact that we decrease the blood flow. We do not cut the whole blood flow to the prostate. The prostate does not die. It will stay alive, of course. Those arteries will reopen. It's just in that period of time, those few days, a few weeks, because the blood flow is reduced, the artery will the prostate shrinks naturally. But since all the structures are maintained and nothing is cut and removed, there are no sexual side effects or the usual side effects of surgery. So I hope this was informative. If you like it, hit the like button and subscribe. Please share with your friends. That's the only way to get the word out. There are people out there that are looking for options. They don't want surgery. Maybe they are not surgical candidate. By doing so, you'll spread this information. And thank you again for your time and attention. Thank you.